Hi, I'm Dani Gasparini, and welcome to this segment of One-on-One. I'm joined today by Don Horsley, whose role today is the president of the Sequoia Healthcare District. Don, welcome.
Thank you.
You and I have had interviews on this program a lot of times where you've been sheriff, where you've had a lot of different hats in our community.
Yeah.
And today it is with the Sequoia Healthcare District. Tell our viewers, what is a healthcare district?
Well, the healthcare districts actually they really started after World War II when there was a number of people from the Midwest came because of all the military activity on the West Coast. And once they got here, realized how wonderful it was, they stayed. So we had a burgeoning population with inadequate hospitals. And so Sequoia Healthcare District really started as a hospital district. And it was the California State Legislature in 1946 actually passed legislation to allow for the creation of these community hospital districts. And so that's how it started in 1947. And in 1950, the hospital was built. By 1996, we had a management agreement with CHW Healthcare West. Mm-hmm. And so they took over running the hospital because it just wasn't really, in an era of managed care, it just wasn't possible for community clinics or community hospitals run by healthcare districts to continue operating. So by 2007, we actually divested ourselves of the actual hospital. Although what we do is we get profit sharing for the next 40 years from CHW Sequoia Hospital. Mm-hmm. We also collect a little bit of taxes. Of all the county taxes that are collected in the district, we get 1.3%, and we aggregate that all for health care in our district. And our goal is to increase access to quality health care. So that's essentially what a healthcare district does now.
So the Sequoia Healthcare District actually started off, its main purpose was to fund and operate a hospital.
Exactly.
As it evolved, you then became a greater organization involved and interested in all aspects of delivering health care.
It doesn't mean that we've completely severed with Sequoia Hospital, though. We've done things like we bought the Da Vinci system that
so you're still funding the hospital through grants.
Exactly. It's a robotic system for surgery. Then we gave another grant to increase the birth center because it turns out that we are having experience in a burgeoning number of births in our community. And then most recently, we've given a grant, or challenge grant, of $2.5 million at Sequoia Hospital for a women's cancer treatment center. And it all is part of our goal of increasing access to quality health care, making sure that our community hospital, Sequoia Hospital, has the best in equipment to provide our residents the best in services.
So let's talk about the district. There are 2 healthcare districts in San Mateo County, correct? And so the boundaries for the Sequoia Healthcare District are about Belmont North to Woodside, Menlo Park South. Is that correct?
We take a little bit of Menlo Park, not all of Menlo Park.
Okay.
We always go to Skyline Highway, all the way back into Redwood City, and like a bit of Foster City as well. One of the things I didn't mention is that we also have an interest in community clinics. And community clinics, well, one is Bellhaven, another one's in North Fair Oaks, and there's another one, Samaritan House. We are a major funder of all those community clinics. They provide services to people who are low income, who have either inadequate health insurance or maybe no health insurance. And what it does, it saves both the county in the sense that it takes people out of emergency rooms, out of costly and unnecessary emergency room visits. And it also keeps them out of private hospitals' emergency rooms. And again, because if people are ill, they're going to go to an emergency room. So these community clinics provide a great benefit. We also just recently, because we do have pretty healthy reserves, we agreed to fund the county $4.3 million for an expanded clinic in North Fair Oaks. That expanded clinic will provide primary care medical services to 26,000 people. So we do a remarkable job of increasing access to quality health care for all.
I think one of the things that really strikes me, and I think that is one of the greatest things that the healthcare district does, is that as a granting agency, as a funding agency, as you said before, you receive your revenues through property tax and that small portion, but then you don't, as a district, try and provide that care yourself. What you're doing is partnering with the agencies, the local agencies that are already doing it and do it best. And you're saying, let me partner and help you deliver and improve your access.
That's exactly true, because otherwise we would be sort of duplicating services
in the
that are
clinic
already
business
there.
or in the hospital business.
And one of the most recent initiatives that we've undertaken is our schools are so badly hit that a lot of the school nursing positions have been cut.
Right.
So we took it upon ourselves. We recognize that one of our goal is community health. And what better way to really assess community health and to make sure that people are healthy, especially kids. We provide two things. First of all, we pay for school nurses in the school districts in our, not all of them, but each one of our districts gets at least $100,000 for school nurses. And then we also we team with the county for the Children's Health Initiative, so every child under 18 years of age who does not have health coverage is covered by the health plan of San Mateo County, which we are the major funder of.
So you've talked about just now the nursing, funding the nursing positions in schools. You've talked about funding Fair Oaks Clinic. You've talked about supportive funding for Samaritan House. You've also talked about funding for Sequoia Hospital in some of its emerging initiatives. What are some of the other large programs that the healthcare district has funded?
Well, there's a St. Anthony's Day Padua. It's a church group in Menlo Park, and it provides a meal. Again, it's one meal a day for people. Again, for low-income people who don't have any other, who are so poor that they probably can't provide a meal for themselves. That we give them about $100,000 a year.
And that's all, it's interesting because someone might say, well, the clinic makes sense, but how does providing meals fit in with a healthcare district mission and vision?
Well, that's a good question.
See?
So what we did is we set up, we do an annual retreat, and we do a strategic plan, and we decide what are our priorities. And one of our priorities is nutritional services. And we want to make sure that people are healthy during times of economic distress. And so that's why, we may not continue funding, say, St. Anthony's in the future when the economy turns around. But at least for now, with the economy in shambles, basically, and the unemployment rate in certain communities being very high, this was a high priority. Another one of our priorities was for this year's mental health. And police departments have program called the SMART program, and what they do is that when they get a call of a person who's is in distress and is thought to have a mental illness problem, instead of having an officer go out who maybe has minimal training in dealing with someone with mental illness issues, instead of having them end up in jail, they call the SMART team, and the SMART team is funded by us, and it takes an officer and a mental health worker who are specially trained, and they go out and handle that call, so that person doesn't end up in jail, so that they take that person to maybe some transitional housing or some treatment facility.
What I'd like to do is invite our viewers to go to the Sequoia Healthcare District website. One, you have the agencies that you fund on your website and some of your mission and values. So if there is an agency out there that is seeking funding, they know the process and how in which to seek funding. But let me ask you this. The Sequoia Healthcare District board members, there are 5 of you. You are all elected at large within the district.
Yes.
I know that you will be running personally for the San Mateo County Board of Supervisors. Should you be elected to that position, what happens to your seat then on the Sequoia Healthcare District?
Well, my seat comes up at exactly the same time as the Board of Supervisors. So if I'm successful, and I hope I will be, and I'm able to continue the same kind of work at the board member as a board member for the county, there'll be people who will run for that seat at the same time. It's not as if I leave at midterm. I wouldn't do that. I wouldn't. It would. Special elections cost a lot of money. We don't really want to spend money on special elections. So we'll encourage people who are in the community who are interested in health.
So the timing would be such that the district would end up having its own normal election for for its own board.
And I'm sure that there are people who'll step up. This is really a great service that we provide for our community.
So we just have about 30 seconds. The strategic plan for the district, again, you said it in one sentence, was health and wellness of this community.
Close, but we also say access to quality health care.
Access to quality health care. That is what the Sequoia Healthcare District is about. Thanks so much, Dawn. Our time is up, and thanks all of you for joining us on this segment of One-on-One. We'll see you next time.